My name is Belén Martinez-Moreno. I'm a gastroenterologist specialized in US and ERCP at the General University Hospital of Alicante in Spain. And I would like to thank Endoscopy for the opportunity to be here and to present the results of our study. On behalf of myself and on the other co-authors, I will present today our comparative study called Correlation of EUS-guided portal pressure gradient measurements with hepatic venous pressure gradient, a prospective study. We all know that portal hypertension in cirrhotic patients is a well-known predictor factor of descompensation and death. And nowadays, hepatic venous pressure gradient remains the gold standard for the measurements of the portal pressure gradient. Although it's an indirect measurement and it's a complex technique that is not widespread. On the other side, US portal pressure gradient has emerged as a new promising technique because it allows us the possibility to perform a direct measurement of the pressure in the vessels. But today there were no comparative studies in cirrhotic patients with the gold standard. And we wanted to find out if we could consider US portal pressure gradient as an alternative option to the gold standard, to the HVPG. And for this reason, we conducted this study in our center, where we included patients with suspected or diagnosed chronic portal hypertension, where every patient underwent both process exploration, the endoscopic EUS-PPG and the percutaneous HVPG. For the endoscopic measurement, we used a standard 22-gauge needle that was connected on the one side to a central venous pressure measurement system and on the other side to a monitor. And we performed a direct transhepatic puncture of the portal vein and the hepatic vein, or the inferior vena cava if the hepatic vein was not accessible. We included 33 patients that accepted to participate, and after experiencing some technical failures, we were able to include 30 patients for the comparative analysis. That means a technical success rate of 93.9% for both techniques. And when we analyzed the correlation between both techniques, we obtained an intraclass correlation coefficient of 0.82, which means that is an almost perfect correlation. We experienced 2 bleedings that could be endoscopically successfully controlled without further implications. And based on our results, we can conclude that US portal pressure gradient with a 22-gauge needle is a safe procedure that shows a high correlation with the gold standard, and we can consider that it could be a valid alternative option to the HVPG. And we believe that the fact that the US portal pressure gradient seems to be a reliable and safe technique even with a standard needle could help to spread the use of the portal pressure gradient measurement to every hospital and every endoscopy unit with an endoscopic ultrasound. And the next step would be to determine which patients would benefit more from one technique or the other. Thank you for your attention.